So we're going to move on to the final two speakers, and we're going to shift focus a little bit to look at API health disparities from the lens of policy. Many of you probably know our next speaker. He's a board-certified radiation oncologist, president of the California chapter of Physicians for a National Health Program, and the former executive director of the Courage Campaign. He is also a stalwart single-payer advocate. Please welcome Dr. Paul Song.
Thanks so much, guys, for having me. And gosh, to follow Richard, I just want to say I'm so grateful for you and your voice and all that you're doing in the South Bay and beyond, and everyone that's on this call. Let me just share my screen because I was asked to, oh, can somebody allow me to share the screen? Oh, there we go. Okay. I was asked to speak today a little bit about the disparities among the double API community and then how it pertains to AB 1400. So I know many of you have heard me speak before on single payer in general, on why a public option is no good, but I wanted to give you a little bit of data on where things are right now. So this is from 2015. As you know, the ACA was signed into law over 10 years ago. But 5 years into the ACA, you could still see that there were quite a bit of members of the double API community that were uninsured. And if you look here, over the last several years, the numbers have come down considerably. Certainly, if you look at the API community compared to other ethnic groups, you know, we're getting better in terms of our numbers. But the thing that I think is important as part of this Kaiser Family Foundation report was down below. It said that nearly half of uninsured Asian Americans are not citizens, and 23% of lawfully present immigrants are also uninsured. And so when I look at where we are, if you look among the various groups, you know, we're not this monolith. You have groups like the Japanese community that have always been traditionally much more insured than, say, the Korean American community that I'm from. And you can see that the Native Hawaiian Pacific Islander community still remains quite large. But this is, you can see that the uninsurance rate has come down, but there's still a lot of people that are left behind. Now, one thing you'll remember with the Affordable Care Act is that there were 3,300 registered healthcare lobbyists for the 535 members of Congress. They spent more than $1.2 million a day, and in total more was spent lobbying Congress than was spent on the Bush-Kerry election. And that's why to this day, we don't have any public option, we don't have any insurance rate or drug price regulation. And these are very important when you look at the impacts on all communities, but especially our community. And just to show you that for those of you who've been getting lucky enough to, quote, get employer-sponsored healthcare, you've been asked to contribute more of your paycheck every year on the front end. And then once you get sick and have to use your healthcare, you've been asked to pay more in terms of co-pays and deductibles on the back end. So as a result, more and more people have far less take-home pay now than they've had over the past several years, as their wages have remained stagnant, but their healthcare costs have gone up despite, quote, getting employer-sponsored healthcare. If you look at the number of Americans who say it's more difficult for them to pay for their health insurance each month in terms of premiums, pay for their co-pays or deductibles, again, the numbers have continued to go up during this time. And let's not forget, in terms of filling prescriptions, 1 out of 5 seniors reports that they're not able to fill a prescription because of cost. And back in 2017, it was estimated that 45 million Americans did not fill at least one prescription because of cost. And as you've heard before, in terms of having insurance, but being underinsured, this is basically showing that 1 out of 3 people has crappy insurance, that the co-pays and deductibles are so high that they've delayed seeking care. So many times when you hear politicians say, we want to cover everyone, coverage doesn't mean anything if you can't actually access a doctor. And then COVID, you know, we just passed 605,000 deaths in the United States. If you look, though, among the AAPI community, there was a 21% increase in the number of deaths among the Asian community just in the last year. Many of them were because of COVID. And, you know, this idea of us being a model minority, just to show you that we have the largest income disparity among any ethnic group. So the top 10% of all Asian earners have 10.7 times the earnings compared to the bottom 10% of Asian earners. And if you look at the number of Asians who are living in poverty, we need to be aware of that and to really advocate for more equality just among our community as well. Now, if you look at the number of frontline workers based on nationality, because this is important in terms of the number of people that were exposed to COVID, you can see that there were a disproportionate number of Filipino, Thai frontline workers. Some of them were healthcare providers. But this is just to show you again, it's a very diverse degree of people who are frontline workers. And why is that important? If you look at the frontline workers who are uninsured, you have a large percentage are in agriculture, meat packing, construction, restaurant cooks. And these are the people that were on the front line throughout the pandemic. And if you were able to have coverage through your employer, just to point out that over 14 million people were affected. Either they directly lost a job or were married or dependent on somebody who lost their employer-sponsored health care. And in California, it's estimated to be about roughly 2.7 to 3 million people that lost their employer-sponsored health care. And then the other thing just to point out was the Lancet Commission showed that 40% of all coronavirus deaths could have been preventable if they had insurance. And this gets back to who was at the front line. So the AAPI community really was hit hard. Now, unlike the African American community that had a disproportionate number of deaths, I would argue that a lot of the people in the Asian community that suffered and died were because they were frontline workers in this pandemic and were uninsured. And if we talk about Medicaid, because this seems to be the only thing that anyone in Sacramento really cares about or says they want to do, is that right now it covers roughly 1 out of 3 people living in California. And among Asian American women, really 1 out of 5 Asian women are enrolled in Medicaid. And, you know, one of the things I would say, and I'm sure that Assembly members Lee, Santiago, and Calra might no longer be on the call, but I greatly appreciate their leadership. But when you see members of the Assembly continually saying, let's just expand Medicaid, meaning add more people to the Medicaid rolls, but they don't do anything to improve reimbursements, you can see here in California, we rank third from the bottom in terms of reimbursements. So this is the Medicaid to Medicare fee index, meaning what you traditionally pay doctors for Medicare. This is showing you that in California, California pays roughly 0.52% or 52% of what Medicare pays physicians in California. And then if you look at how Medicaid compares to other states, you have states like Alaska that are at the high end. But again, we're third from the bottom in terms of reimbursement to providers. And it's no wonder that patients cannot find providers. I'm sure Richard will tell you that at UCLA Harbor, he sees patients like he mentioned that you can't get a specialist to see them because so few people accept the really bad reimbursement rates. And it's gotten so bad that the LA Times has done numerous stories on people, many of them were from the AAPI community, waiting over a year to see a doctor. And now you have this push to add more people to Medicaid, but not one effort to increase the funding to try to get more doctors to take it. So it's just going to further cause a logjam and really disproportionately hurt the API community. This again is just showing you that the private, they not only have the reimbursement's been so poor, but the state has basically brought in for-profit companies and that have further denied and narrowed the networks. And as Richard mentioned, you have people that will travel 45 minutes to an hour just to go see a doctor for the sake of finding somebody that will actually take care of them. But this just shows you that who is profiting off our Medicaid system here in the state of California. Health insurers like Centene and Anthem have managed to make nearly $500 million a year off of our Medicaid system, which in and of itself is just so criminal. And it's no wonder that a judge has ruled in favor of MALDEF. The Mexican American Legal Defense Fund sued the state of California, claiming Medicaid was separate and unequal. Back in 2017, the state fought back and has appealed that, but finally a Alameda County Superior Court judge has ruled in favor of allowing this to move forward. It really is an apartheid system and something that is affecting so many people. So, you know, here's the problems here in California, right? We have 3 million that are uninsured, you know, another close to 10 million that are underinsured. We don't really have full coverage for undocumented brothers and sisters. We have this separate and unequal Medicaid system. We have no insurance rate regulation, no drug pricing controls, continued narrow networks, which are even more narrow for Medicaid recipients, high copays and deductibles, administrative waste, overall inefficient system, and no security with job loss. And all of the plans up to date that have been proposed in Sacramento, short of AB 1400, don't address any of this. So just to point out again that this was a study in 2016 showing you that for every healthcare dollar that's actually spent on here in California, 70 cents of every healthcare dollar is already paid for by us, the taxpayers, either in terms of tax breaks to Apple and Google to provide health care to their employees, providing healthcare benefits to every state and city employee, teachers, paying for pensions to provide healthcare. This is just showing you that we're basically paying for a full system. We're just not getting the type of system we deserve. And this was also something that's very important when you look at the commissions and how they're reporting things. This is a study that was done by Michael Rodriguez at UCLA. When they looked at 22 different analyses of single payer plans over the last 3 decades, they found 86% of them saved money in the first year and 91% saw savings in the long term. And this is on top of insuring everyone and giving everyone better benefits than what they have right here. So we need to continue to point out that we're already paying 70 cents of every healthcare dollar right now. When you take away the administrative savings, we're basically paying for it. And this is just, again, proving to you what every study has shown, that this would save money while insuring everyone. So just to point out, CalCare, it covers everyone, including our undocumented brothers and sisters. It's not tied to employment, eliminates copays and deductibles, have choice of doctors, reduces overall spending while insuring everyone, eliminates administrative waste and costs, and negotiates deep discounts in drugs and costs of services. And I just want to conclude by saying that, you know, Shirley Chisholm, she ran in 1972 under the mantra of being unbought and unbossed. She said this in 1972 when she ran for president: "We have never seen health as a right. It has been conceived as a privilege available only to those who can afford it. And this is the real reason the American healthcare system is in such a scandalous state." And unfortunately, short of the 3 assembly members that we had speak to us, when they said there are 19 co-sponsors. So when you look at nearly over 100 elected officials in Sacramento and a quote supermajority of Democrats, the fact that we can only find 19 co-sponsors of AB 1400 suggests what I've said all along, that we have too many politicians that are bought and bossed, and that you know, we really do need to set about a political awakening. So many of you who've rolled up your sleeves and encourage people to primary these people, I think we need to just continue to do that, because we're certainly not getting the type of voice and representation in Sacramento that we deserve. And finally, I just want to say thank you to CNA and the nurses for continuously pushing forward a single payer legislation and organizing. And I would say that it's still very important that we all get around it. For those coalitions that have still not fully endorsed it, I think they need to get off their hands and really get behind this. So I just want to say thank you very much for allowing me to be part of this tonight, and thank you all.
Thank you very much, Dr. Song, for giving us a big picture analysis of the healthcare statuses of the very heterogeneous API communities, and also pressing the point that we have a big political fight ahead of us if we want to win.